Thank you for joining us this afternoon. We are so excited to start this webinar. As you may know, May is Mental Health Awareness Month and Stroke Month. Two important topics on their own, but it is also so important to look at how they are intertwined. And that's why we are here today to talk about our mental well-being and how it can relate to our cardiovascular health and even increasing the likelihood of having a stroke or heart attack. We are also going to learn how to spot a stroke fast and so much more. We've got two incredible experts from Kaiser Permanente who will guide our discussion today and really help us make that link between our physical and mental health, or what Kaiser Permanente calls total health. So we also will be taking questions in this chat that you can see right now on your screen. So let's try that out right now. Drop in the chat where you're logging in from. And before we start, I want to introduce myself. I'm Stephanie Ochoa. I'm an anchor and reporter at Telemundo, Washington. And also, I have the pleasure of introducing Dr. Rita Laik, a cardiologist at Kaiser Permanente, and she's joined by her colleague, Dr. Stacy Neal, a psychiatrist at Kaiser Permanente. Thank you, Dr. Laik and Dr. Neal, for being with us today.
Thank you for having us. We're very excited.
Thank you so much.
Thank you so much. So we're going to start with this question, and I'm sure the people that are joining us today have many other questions, so we're going to go through all of them. But first, how does our mental health, such as our stress level, affect something like our heart health and specifically our risk for having a stroke?
Yeah, so we naturally understand that stress can affect us emotionally. It can make us feel nervous, anxious, even depressed. But the stress hormone, cortisol, also increases our heart rate, blood pressure, breathing rate. And these changes in the heart rate and blood pressure and breathing rate could be helpful if there was some physical danger that we needed to escape. But in our modern world, we are often under the chronic stress of, work responsibilities, family responsibilities. So there isn't anything that we can run away from, although some of us would like to. But so that chronic stress can lead to chronically elevated blood pressure, which can increase your risk for heart attack and stroke. And in turn, the way that we try to cope with stress, some of the ways we try to cope can be unhealthy and increase our risk as well, such as smoking, physical inactivity when we're very stressed, or overeating, which can lead to obesity and also in turn increase our risk for heart attack and stroke.
Yeah, I agree.
Yeah,
I agree with Dr. Neal. I mean, she summed it up really nicely. I think both of those direct and indirect factors play a huge role. And so, for kind of the direct things we think of is the metabolic changes that happen within your body, like she mentioned, the stress hormones, the, autonomic nervous system, for example. All those imbalances in your body have consequences and progression of risk factors for cardiovascular disease, both for heart attacks and for stroke, but also like indirect factors that she mentioned, like the bad habits that come as a consequence of the stress. I myself, I'm a stress eater. And so of course, you're going to go for those snacks that are unhealthy, for example. And not only that, when you have a lot on your plate, when you have so much going on in life, well, what I often find is patients saying, well, they put their health on the back burner. They're like, oh, I was supposed to follow up for my diabetes. I didn't. And that's why my diabetes is out of control. I've had many patients say, my son got diagnosed with cancer, so I've been taking care of him, not myself. And so we forget that, you may not be eating unhealthy or smoking, but those external factors also have an indirect effect on your overall risk.
Dr. Laik, if you could say 3 signs, 3 red flags we need to be very attentive to, which could be?
In terms of reducing cardiovascular health or red flags for stroke?
Red flag for stroke.
So red flag for stroke, AHA actually has a great mnemonic. It's called FAST. And so this is kind of supposed to help people remember. So one thing you want to look at is have people look at their face and look for facial asymmetry. So you can ask someone to smile, you can ask them to raise their eyebrows, and any kind of unequalness between the right and left side of their face could be a sign of them having a stroke. You can ask them to put their arms out straight up in front of them and close their eyes. And if one of their arms drifts down, drifts away, that shouldn't happen. So that's abnormal. You can ask them to repeat a sentence that you're saying, or tell them to sing a song or a phrase. And if, if their speech sounds garbled, if they're slurring their words, you can't quite understand what they're saying, and that's very atypical for them, then those could be potential, signs. And then the last thing is the T, which is to remember timing. Timing is very, very crucial for stroke. The reason being, a lot of the interventions that we offer for stroke has to be within a certain time frame. And so if you notice the symptom and you immediately go to the hospital, there's more for us to offer, and there's more chances of recovery because we're able to intervene sooner. Sometimes people don't realize it, or they think, oh, my family member's sleepy, that's why they slurred their words. And the next morning you realize the problem persists, then you're kind of what we call outside the window of us to be able to do any intervention acutely. So timing is very, very crucial.
That's very important to know. And so before we keep going, I just want to read these answers we are getting in the chat. So people joining us from Arlington, Virginia, Washington, D.C., Frederick, Maryland, and I guess Alexandria as well. So there are people around the DMV area. That's so good to know, because that's very important to talk about this. So next, Dr. Neal, since the pandemic, what trends have you seen regarding stress and anxiety in people?
We've definitely seen since the pandemic an increase in people seeking mental health services for depression and for anxiety. And some studies show that over half of US adults report that the pandemic have had a negative impact on their mental health. I've seen things like, at the beginning of the pandemic, the effects of grieving, losing multiple family members or friends in a short amount of time from the pandemic, and then perhaps not being able to see them in the hospital, when they're ill because of social distancing guidelines, and the same for funerals. And that was very hard on people. I've also had patients who were very stressed. They were working from home and maybe also parenting small children from home who were doing school online, and then the parent is trying to work and supervise a child's school. That's tremendously stressful. On the flip side, I've seen people who sort of thrived at the beginning of the pandemic. They liked being able to not go into the office and have that commute, but now they're facing the stress of returning to in-person work, and they have a lot of anxiety about that. And then also the isolation, the social isolation during the pandemic was very hard for a lot of our older people or disabled folks who need that kind of interaction for their mental well-being.
Dr. Neal, I am getting a question here in the chat. People are asking, are we still seeing the effects of pandemic stress in 2023? It often feels like the world has moved on while many are still struggling.
Yeah, absolutely. I think that I feel like the stress is a little bit less than it was maybe right in the beginning in 2020, but certainly I'm still seeing the effects in a lot of my patients who are still struggling with the effects of the pandemic. Some are struggling to reconnect, even though the world has opened up, they have kind of lost connections, and they have to find ways to rebuild that connection that's so important for our mental health. And again, like I mentioned, some people who actually didn't find the pandemic that stressful find the end of it stressful, because maybe they got a reprieve from a difficult boss or coworker when they were working from home, and now they're faced with kind of returning to that environment.
Thank you so much. Dr. Laik, we also saw many people that stopped being active during the pandemic because they were in their houses, they weren't able to go outside to work out. That is another risk factor.
Yeah, no, and that's definitely one of the big things that we saw from a cardiovascular health standpoint with the pandemic. You know, not only did the stressful situation of being through a pandemic, but also we noticed people were not coming in for doctor's visits, right? So people felt very reluctant and scared, rightfully so, to come in for routine follow-up. So some patients were not getting their meds on time or not managing their diabetes correctly because it was felt unsafe to, you know, follow up, not because they didn't want to. Um, and then as a, you know, secondary consequence, obviously physical inactivity leads to weight gain, which then leads to more, you know, risk factors. And, you know, a combination of both of those things, I think had a huge impact. And one of the things we actually started noticing on the inpatient side was people weren't coming in even for the, you know, the normal things that you'd want to get checked out for. So they were presenting late after a heart attack because they were like, oh, you know, it's probably heartburn. Let's wait it out. Let's see late after a stroke. Like I said, timing is very important for a stroke. And so we did see a lot of that where people were coming in, getting care delayed because of the fear of coming into the hospital.
Of course, we are still getting more questions. We're going to go through all of them later after a few more questions that we have here. And especially because we have parents, we have moms, we have dads here with some concerns we have to go through and to try to explain them better about some risk factors. But I want to keep going. What are some tips to better manage stress levels? A little stress is normal, but what are signs that you might need help? That's a key question, Dr. Neil, because we don't know when it is time to go to the physician, to go to the psychiatrist, when.
Okay. Yeah, I'll talk about some tips and then when it's time to seek more help. So one of the best things I think you can do to manage stress is get some exercise, some physical activity. Like I said, that cortisol, that stress hormone that goes up when you're stressed, it's designed to help you move. It's to help you move away from a danger. So getting moving can actually help expel that cortisol and decrease that cortisol level. So exercise is kind of one of my top recommendation. Meditation, a regular meditation practice can also be very helpful. There are studies that show that a regular meditation practice can lower anxiety levels, decrease symptoms of depression, improve concentration, improve sleep. So I definitely recommend that. Deep breathing exercises can also be very helpful because when we're stressed, we tend to take short, shallow breaths. And if we can be mindful to take deep, slow breaths, it actually kind of tells your brain that you're not in danger, and it can help you feel more relaxed. There are also studies that show that being out in nature, like around a lot of greenery, can be very helpful in reducing anxiety and stress. So one way you could hit multiple strategies is take a walk out in nature and maybe do a relaxation exercise outside. That can be helpful. The American Heart Association's webpage has a lot of resources there for evidence-based practices that can be helpful for managing stress. And Kaiser Permanente members have free access to like the Calm app, which has some nice guided meditations that can be helpful, and sleep stories. There are many other things that can be helpful, like progressive muscle relaxation. But the signs that you need to seek professional help are that perhaps you're doing many of these things and you're still experiencing a high level of anxiety or symptoms of depression, or if you're finding that you can't function at home or at work like you normally would, or if you're turning to unhealthy coping strategies like alcohol or drugs or smoking, those are signs that you might want to reach out to your physician, who might in turn have you speak to a mental health professional.
Dr. And going back to the first part of your response, it's necessary to let people know that maybe it's not mandatory to go to the gym for an hour every day, because maybe we don't have the money to pay for the gym, but we can also go and walk in the afternoon, take a stroll.
I'm so glad you said that, because usually when I recommend exercise, the first thing that someone will tell me is, well, I can't go to the gym. I either I don't have the time, I don't have the resources for that. And I don't think it has to be in the gym at all. It can be at home, put on a YouTube video or an exercise tape. It can be outdoors. Like I said, outdoors, you're hitting multiple, you're getting the benefit of being out in nature and the benefit of the exercise. I think that's excellent. I think simple things like, when you park at work, parking farther away from the door and taking the stairs, I think every little bit helps. It doesn't have to be going to the gym for an hour.
Thank you so much. And Dr. Laik, the same question, but for you, looking at stroke and cardiovascular illness, what trends have you seen in the wake of pandemic in terms of strokes and heart diseases?
Yeah, so with the rise in the stressors that Dr. Neal pointed out, I think that has been a big driver of this, both for the direct and indirect reasons that we initially talked about, people putting on weight, being less active, more sedentary, in combination with those external stressors that have now been in play. And then patients not coming in for follow-up. So obviously we're seeing a lot more people with poorly controlled diabetes, blood pressure is not controlled, running out of medications, not seeking care at the appropriate time. And so a lot of those things, I've had people, come to see me that had a stroke, a while back, and they haven't had the proper routine workup that we usually recommend. And it's been, a year and a half, 2 years out, which in a non-pandemic world is very surprising because usually, we order things, we get things done, we get answers. And so we are seeing those consequences even up until now, where care has been fragmented because of the pandemic. But, now it's the time to be more proactive to kind of change that going forward.
That's a key word, consistency, because we can go to a doctor, we get a good result and we say like, okay, everything's fine. And we don't go back few years later, maybe. So that's very important to know. Thank you so much. So now this month is a stroke month. Let's talk about that. What are the risk factors for having a stroke and what are the signs, symptoms to look out for what you might be having a stroke?
Sure. Yeah. So the risk factors, like we talked about, obviously there's the, indirect risk factors of stress, anxiety, mental health illness, and then the medical risk factors such as uncontrolled blood pressure, diabetes, high cholesterol, smoking, obesity, strokes kind of happen for two different reasons. There are strokes that we actually, think about. You can have a stroke from bleeding into your brain. You can have a stroke from having just high cholesterol and deposits in the blood vessels that supply blood to your brain. Then you can have a stroke for reasons outside of that, which is related to abnormal heart rhythms like atrial fibrillation, which we often will see. And, with the advent of smartwatches, we're detecting more and more of that. But that can put you at risk for a stroke indirectly because that rhythm actually causes you to develop a blood clot inside your heart. And when it leaves your heart and goes to the brain, it causes a stroke. And so all of these, kind of work hand in hand, and the whole importance of following up with the doctor is obviously making sure that those risk factors are controlled that we just talked about, but also making sure that if you're optimizing the risk factors, that there isn't an other alternative underlying reason like having atrial fibrillation or having something else that may be causing the stroke.
Okay, thank you. So given that we have two incredible female physicians here with us today, I wanted to draw attention to the risk of stroke for women because stroke is often thought of as something affecting older men. How common are strokes in women and are the signs of stroke different for women than men?
Sure. Yeah. So the signs of stroke are the same in both men and women. At younger ages, we tend to see men having a higher likelihood of stroke, but women tend to live longer overall. So their lifetime risk of having a stroke is higher. 1 in 5 women typically between the ages of 55 to 75 will have a stroke at some point. And the larger strokes obviously can be prevented with appropriate follow-up and appropriate screening. Women also tend to have higher risk of stroke because of other factors, right? So we tend to have higher blood pressure, higher incidence of high blood pressure, preeclampsia, which is high blood pressure during pregnancy. Women often get put on birth control, which in some individuals can predispose you to having blood clots. So that also increases your risk of strokes in women.
Thank you, Dr. Laik. And Dr. Neal, so many women are also shoulder more of the household responsibility and may feel too busy taking care of others to take care of themselves. Have each of you seen this in your practice, especially you, Dr. Neal, like what kind of stress you can develop in like taking care of the children, taking care of the house, working at the same time?
Yes, absolutely. It's so common that women shoulder so much responsibility at home, and also, you know, they maybe working full time just like their partner. And so I do see that frequently. I think that there are complicated reasons for that, and women can try to shift that. I think that there should be a drive to not just kind of deal with shouldering more responsibility, but kind of try to shift some of that over to your partner. I think it takes a mindset shift because many of us kind of have these ingrained sort of gender roles where maybe the woman does the cooking and the cleaning and the laundry and taking care of the children. But I think if there are men listening, just be mindful that your partner may be feeling stressed and burdened by all of those responsibilities. And for women, I think also a shift in realizing that your partner is very capable too. Just because you're the woman doesn't mean you are somehow more capable of taking care of the children or more capable of getting laundry done. I mean, those are things that likely your partner was, things like laundry and cooking, they were probably doing on their own before you marry. So I think a mindset shift is important. And I think we tend to feel a lot of guilt about taking care of ourselves. But to, like I said, shift the mindset to where you feel that taking care of yourself is a necessary part of taking care of your family. That this idea that you can't pour from an empty cup. And so you have to fill your cup so that you can fill the cup of your family. And also the idea of kind of putting your oxygen mask on first. And I think that when we take care of ourselves, we give a better version of ourselves to our family.
Yes, and also I think we need to take seriously this topic, especially when we talk about the family. So we need to sit down with everybody in the family and say, okay, this is what might happen if we don't take care of ourselves. So what can we do? This is not a talk of just one person.
Absolutely. This is the family's issue. It's not just the mom's issue. Right. Exactly.
Thank you so much. So now, well, we have many questions here in the chat. I want to go through all of them. I already read this one. So, okay, we have here one. Is there more risk of stroke with stress at different ages?
Yeah, so theoretically, the risk is higher the older you are, right? So as you grow older, you have more medical problems. So your high blood pressure, cholesterol, diabetes, all of that. When you're 30, you don't have those risk factors in place. So your risk factors with age go off, and therefore your stroke risk obviously with age increases. And that's why women, because we live longer, tend to have that higher risk because we get to those advanced ages, more often than men. The other thing is also, as you get older, there's going to be more and more risk factors that you accumulate. So you become more and more sedentary. People start to, what I commonly see is knee arthritis is very limiting for people. It makes people debilitated where they do not exercise or do much, and it's very difficult for them to be active. And so you slowly, progressively put on more and more weight, and it's hard to turn around at that point. So.
Dr. Lai, during the pandemic, we saw that also young people were affected by many factors, and also they developed many different illnesses. So even though this affects more older people, what should young people be aware of just to avoid any situation later?
Yeah, so I think kind of the 2-3 big things is when we're young, we think we're completely healthy, that diabetes is for the old people, right? High blood pressure is for the old people. It's okay if I gain down 10 pounds, I'll lose it. But that becomes more and more challenging, even as you go from 30 to 35, 35 to 40, although you may still be, young. And so I think it's just as important for a 30-year-old to see their primary care doctor once a year as it is for an 80-year-old to see their primary care doctor, because there are certain screenings and certain guidelines that we follow to look for diabetes, to check your blood pressure, to check your cholesterol. All those things must be checked. I have many patients who physically, will be very fit. They run, they are very active, and you check their blood work and their cholesterol is sky high. It's not anything that they're doing, but maybe you have a genetic predisposition or a family history. And so all of those things are only, going to be caught by you going to the doctor. So it's equally as important for you to see them early on as it is later on in life.
And what about habits? Because sometimes I'm used to do this because my dad used to do this, my mom used to do this. So this is the way I am, and this is the way I eat, this is the way I work out. So we need to stop certain cycles in terms of habits so we can improve our health.
Exactly. And I think that's supposed to start on early on in life, right? Taking on the bad habits at a younger age is only going to lead to more negative consequences. So you have to be proactive and intervene early on.
And
Thank
I
you.
want, oh, sorry, I just wanted to add, I think that's a great point. And another reason for self-care is that you're training your children. If they see you exercising, if they see you eating right, if they see you with a meditation practice, they're more likely to adopt those habits.
Right. And well, Dr. Neil, there is a question especially for you. We were talking about mom's family, and here Elizabeth Treble asks, any advice for moms in prioritizing self-care and mental health? We all know we need to do it, but it never feels like there's enough minutes in the day, and our own needs slip down on the to-do list.
Yes, I think that at different phases of your life, self-care might look different. I think, maybe when your children are grown, you might go away for a week's retreat. But when they're small, I think one thing that I think can be very helpful is including your children in your routines. Like, if you're exercising, I've seen, these yoga tapes that are like mommy and me exercise, or aerobics that are like mommy and me. So not, if you can't have your own alone time for 15 or 20 minutes, just let the kids be there. They can be your dumbbells, or you know what I mean, just let them and it might throw your work off a little bit, and to, don't have that expectation for perfection, but just the, like you said, consistency. Like, if I can get in, 10 or 15 minutes a day of some exercise, and like I said, using it as an opportunity to also teach your children about, meditation and breathing exercises, and just let them be there if you can't have your own alone time. And again, like I said, we do kind of resort to these gender roles, but really trying to get your partner on board with, giving you some time, and, and they take the kids so that you can take care of yourself, because they're going to be happier too. If you're happy, I think it will be felt throughout the household if they can give you that time.
That's true. And when you say maybe 10, 15 minutes, it sounds like it's a lot of time if we have a lot of things to do, but sometimes we're scrolling down on social media for an hour and we don't even realize it has passed already an hour. So
absolutely,
we can spend on that.
Absolutely. And I think, if 10 or 15 minutes is too much, I think 5 minutes is good enough. Take what you can get, as long as you can be consistent, and then maybe you'll get lucky one day and you'll have 30 minutes, and maybe the next day you don't have that. But just try to be consistent and at least put it on your list, even if you don't always get to that bullet on your list.
Right, thank you. And Dr. Lake, I think we have talked about this, but here is a question from Erin Hutu. how can you self-monitor stress level to prevent a stroke?
Yeah, so that's a tough question because we don't have anything like a Fitbit, right? Or an Apple Watch to be like, oh, stress level is high. But I think it requires a lot of self-awareness and kind of reflecting on how you respond and react to things. So if your stress level is high and your response is, well, I'm too busy, I'm just not going to go to the doctor. I'm too stressed out, so I'm going to go out for a smoke. And I'll have patients say this where they'll be like, oh, I quit 10 years ago and I, recently had a stressor. So now I'm back to smoking. And the point is to recognize a bad habit and stop it and find an alternative. And I think the part that we struggle with is finding the alternative, what will work as a substitute that's going to be equally as easy for them to be able to cope with whatever the stressor is. And so you can't necessarily monitor with, any direct method, but it more has to do with self-awareness.
Dr. Lai, can correct me if I'm wrong, but sometimes when we have so much stress, it can reflect in some other parts of our body. We can have pain in some parts of our body. We can be, I don't know, more, we do all our things in a slower pace. So there are some signs we can feel physically.
Yes, for sure. And I'm sure Dr. Neal sees this quite often, but you'll get non-specific symptoms. So people will complain of fatigue, that I'm just tired, or inability to sleep or poor sleep. They'll try to sleep and they'll wake up because they're stressed or have difficulty falling asleep. People may complain of headaches frequently. You might not have, friends invite you out and you just don't want to spend time with them. You don't want to go do the things that you enjoy to do because your stress level is high and you have other stuff going on. And so some of those factors are obviously outside just the realm of having a stroke per se.
Right. And Dr. Neal, here a question from Emily Cooper. What would you suggest saying to your doctor if you feel like you are struggling to manage stress? Any tips to help facilitate that conversation?
Yes, I think that just starting, just like you said, like I'm having trouble managing stress. I think that's a good way to open the door. So I think our primary care physicians are very aware. They're seeing this so much during the pandemic. So I don't think it takes a specific script to get your doctor to understand, but being sure to let them know if you're having trouble sleeping, especially if you're having any thoughts about hurting yourself, you definitely want to let your doctor know. Again, if you're not able to function at work or at home, let your doctor know. And sometimes if you get very nervous when you go to the doctor and you forget what you want to say, I think it can be helpful to just write a script and take it with you into the doctor's office so that you don't forget what you want to say.
And also, I don't know if that may work for everybody, but maybe journaling, maybe writing every symptom we feel during the day so we don't forget, because we're accumulating all these feelings, all this stress, and then when we go to the doctor, we don't know where to start.
Exactly.
So journaling, that would be a good tool.
I think journaling is an excellent tool, not just for the doctor, but I think journaling is a very helpful stress management tool. Talking to a therapist can be helpful, but you may not always have access to that every day. So if you have a lot of thoughts swirling in your head, you're ruminating about stress, getting it down on paper can help you to release it, help your brain to let it go.
Perfect. And the last question for Dr. Laik, and I think we talked about that already, but is stress tied to a specific type of stroke?
Not necessarily. It's more indirect. So obviously, like the risk factors that we talked about, doing the unhealthy habits like smoking, high cholesterol, diabetes, whatnot, weight gain is all going to put you at increased risk. But then yes, as you gain weight and have obesity, you're higher likelihood of having disorders like sleep apnea, your higher likelihood of having atrial fibrillation, and that is also a risk factor for stroke. So those unhealthy habits indirectly lead to increasing all types of stroke risk.
And is there a correlation between blood pressure and stroke?
Yeah, so if you have uncontrolled blood pressure, so it can actually cause a stroke. So the type of stroke where you bleed into your brain can actually typically happens when your blood pressure is not well controlled. And then having high blood pressure in and of itself also causes damage and stress on the arterial walls that puts you at risk for stroke as well.
Thank you so much. I think we are about to start wrapping up, and but before that, I want to ask you if you have any additional information you want to share with our audience today.
Oh, I would love to add, Dr. Lai talked about the effect of obesity on your heart health. There have been studies that show that having this abdominal fat also you're more likely to suffer from like mood disorders and anxiety. So, the exercise and getting to a healthy weight is not only beneficial for your physical health, it's going to be beneficial for your mental health as well. So it's just one more reason to exercise and eat a good diet.
And I think probably speak for in general, from a non-physician standpoint and from a physician standpoint, our jobs are equally stressful. And trust me, I really do say I try to practice what I preach, but I am right there with you in that in the hustle and bustle of your busy day, those stressors come, and those bad choices also come. And it's finding a balance between identifying them, doing what you can humanly possible to mitigate those. Like I'm a stress eater, and so to avoid the risk of that, I basically opt to keep only healthy snacks so that I don't eat unhealthy foods. And so I know I can't get rid of the stress eating habit. That's not going anywhere, but I can change the choices or what I'm eating at that time. And so and all these changes, that we talked about are they take time. And so be patient and just be more proactive. And, like Dr. Neal said, even 5 minutes a day for yourself.
Right, little decisions to make a huge change. Thank you so much. And just as a reminder, the American Heart Association and American Stroke Association have many tools and resources online at stroke.org/stroke month. So if you want to go there and read more about this, it would be very helpful for you all. So that's our time today, and I want to thank Dr. Laik and Dr. Neal for this incredible conversation and expertise. A huge thank you to Healthy for Good sponsor Kaiser Permanente for their ongoing support of the American Heart Association in today's conversation. The American Heart Association has many great tools and resources online. As I told you, you can visit www.heart.org for some great tips to reduce stress. You can also find many resources on stroke there too. Also, we want to remind everyone that the American Heart Association has many great events to get your heart pumping and your feet moving more. And our Heart Walk is on November 4th, and it's a great way to get your family and friends out walking. We'll be back on the National Mall for our biggest walk ever, and I hope to see you out there. Once again, thank you all for taking the time to prioritize your well-being and being a part of today's amazing conversation. Check out these resources. You have them in this chat from the American Heart Association to learn much more. Thank you so much for this.
Thank you.
Thank you for having us.
Thank you.